WHO's surgical safety checklist has been made mandatory by the National Patient Safety Agency. Patient Safety First identified the need for pre- and post-operative briefings, as well as the checklist. This led to the creation of the 5 steps to safer surgery. Here in Chapel Allerton Hospital in Leeds, this orthopaedic surgical team gather in the morning for their pre-op brief.
Right, I'm Mark, surgeon.
I'm Jan, senior ODP.
James, the assistant.
Second side hip replacement, left side today.
As far as the surgery is concerned, he's fairly straightforward. The briefing is so important as far as safety is concerned because those issues may not have been shared with the team if we hadn't had a briefing. And if everybody knows about it, it's much more likely that the right things are going to happen. One of the great concerns about briefings is that it takes up too much time before the list starts, and that was quite a long, that probably took 7 or 8 minutes. But we've picked up something, which is that the patient needs to have vancomycin, and the delivery of that drug takes an hour. If we hadn't picked it up in the briefing, that would have delayed his case by much more than the 10 minutes it took us to do the briefing. And that is universal. Every time you do a briefing, you find something which is going to save more time than it took to do the briefing during the day.
After the briefing in the anaesthetic room, the patient is signed in. The patient's name is confirmed, as well as a number of safety checks, including the area to be operated on.
The sign-in means that we have got the right patient having the right operation, the right side. If it's a long list of day case procedures, then very possibly it's a very fast turnover list. It's quite easy to make a very simple mistake.
Once a patient is anaesthetised, he is brought into theatre. Careful preparations to ensure safety are carried out, and then, just before incision, there's a time-out.
Everyone ready for a time-out? Okay, this is Mr. Michael O'Sullivan, the surgical site infection bundle. That's been completed. Are the antibiotics in? You happy with the kit?
Yep.
All sterile?
Yep.
We're happy with the position and draping. Everyone happy before we start? Okay, let's go. Right, we're just going to do a sign out while we sew up. Yeah, let's do the sign out then.
Has it been confirmed that instruments, swabs and sharp scans are complete?
They were correct.
And the sign out is basically to check that we've got everything we started with. We know what that we've done, the procedure we said we were going to do, and then any specific things such as kit issues, the specimens, and key information for recovery is not forgotten. The patient was MRSA positive when he was screened about 10 days ago, and therefore should have a side room in recovery, which we would not otherwise have picked up.
Once the day's list has been completed, the team gathers one last time for the post-op debrief.
Was there anything we could have done to make the list safer? By going through the debriefing at the end of the day, we identify any hiccups that we might have had, any glitches, anywhere we could just polish our act ever so slightly.
The importance of this process, the evidence for it providing benefits for patients, staff and surgeons and anaesthetists and everyone involved is overwhelming. It is now a responsibility of everybody who is involved to make sure that it happens.
It brings the anaesthetist into the team, it brings the theatre staff into the team, so it means that everybody's on a sort of level par, and the main concern is obviously patient safety, and it brings patient safety to the forefront of everybody's mind.
One of the most useful things for me directly was that I could then become acquainted with the members of staff that I may not be familiar with, and also they were more comfortable in talking to me and highlighting any areas of concern that they may have about my practice as well.
If this is used as a box-ticking exercise, it will not offer any benefit to anybody. And unless we use it as it is designed, which is a tool to change culture in the operating theatres, it won't be as effective as it could be. The 5 steps are simply a tool to improve the culture of the team and the systematic way in which we communicate between each other to improve safety for patients.
It means everything for patient safety. Patient safety is the reason we're here.